The burden of cancer care in Uganda remains huge, with the mortality rate pegged at about 25,000 deaths of the 46,000 new cancer cases registered annually. Dr. Jackson Olyem, the executive director at the Uganda Cancer Institute, has revealed that even though access to treatment has improved to about 22%, up from 4% 15 years ago, this is still minimal given the weight of the burden.
Every 100 people who get cancer, only 22% of them at any one time can actually access care, which is very low. You'd expect that at any one time there should be actually 100% survival if the disease is very treatable, but the fact that more than half or up to about 78% of those new cases that I've spoken about die, that is a very, very high figure.
Cancer treatment is free at the Uganda Cancer Institute, but this is easily accessible only to those within the Kampala metropolitan area. Dr. Olyem says this is why government is establishing more regional institutes.
Government is increasing investment in as far as cancer care is concerned, and this includes things like infrastructure, equipment, and then also the human resource.
The leading type of cancer afflicting Ugandans is cervical cancer, but the most lethal disease in this category is oesophageal cancer. This affects the throat and is mainly caused by too much alcohol intake, accounting for 48%, tobacco intake and poor ventilation, as Dr. Alfred Jato explains.
Excess consumption of alcohol, and then use of tobacco, whether through chewing or smoking, and then drinking hot beverages over time, and then unhealthy diet, another diet, meaning when you don't mix your diet well, you don't eat varieties, and then you don't eat adequate amount of fruit and vegetables, the risk of developing esophageal cancer goes higher. And then we are also seeing, study has also shown, people who live in houses which are poorly ventilated.
The doctors have appealed to line authorities to ensure that Ugandans have access to proper medication for this cancer that has no proper test kits and is still being analyzed across the globe. Meanwhile, experts have reiterated calls for members of the public to check in early at hospitals for proper treatment to save lives.
Even though you have all the equipment, you have all the facilities, but if the patients are still presenting very late, that means even if you treat them, the outcome is actually not likely to be very good. So that is a big challenge.
Juliet Naloga, NTV.